Hello everyone and welcome back to Clinical Cousins YouTube channel. Today we're going to go over the transition zone and then we're going to look at Osborne waves, also called J waves. So the transition zone is simply the part of the EKG where the QRS complex transition from a mostly negative complex, meaning that most of the QRS complex is negative, to a more positive QRS complex. The transition zone usually occurs between the negative V3 to a positive V4. So we would say that this is the transition zone. Now, if the transition zone occurs earlier, say that the QRS becomes positive in V2 for some reason, then we say that there is a counterclockwise rotation because the transition zone goes from a negative V1 to a positive V2. Now, if the QRS complex becomes positive later, say it becomes positive in V5. So the transition zone will be between a negative V4 and a positive V5. We say that this is a clockwise rotation of the transition zone. So now that we understand a little bit about the transition zone, we're going to talk about Osborne waves. Now when a baby is born, are they warm or cold? They are cold, so we put them directly skin on skin with mom to warm up, or we put them in a warmer or incubator. So it is similar to Osborne waves. Osborne waves indicate that our patient is probably hypothermic or experiencing low body temperature. Remember the J point, the end of the QRS complex? If we have a wave at the J point, it is called a J wave, or also known as an Osborne wave. Remember that Osborne waves usually indicate that the patient is below 32 degrees Celsius. That's very, very cold. And the colder the patient, the higher the amplitude of the J wave shown here. So some common causes of hypothermia are due to environmental exposure being the first, or it can be due to Addison's disease, severe sepsis, or hypothyroidism. So this wave can appear as sort of a slurred R wave to S wave, or it can actually appear as a notch at the J point. It is important to remember that if the patient is cold, we must treat the heart like it is a block of ice. We must remember not to shatter the ice, meaning that we must be extremely careful when transferring or moving the patient, because sudden movement and extreme cold can send the heart into ventricular rhythms such as ventricular tachycardia and ventricular fibrillation. Think, the heart is very cold and irritable, so it is just looking for the chance to send it into a ventricular rhythm. So the important thing to remember here is that we must treat the underlying problem, meaning that the underlying problem is the fact that our patient is cold. So we can shock them and give them all the catecholamines we want, but unless we warm them up, we are going to end up in the same rhythm. So please remember, no sudden movement, and warm the patient so that your treatment can be more effective. As always, thank you for taking the time to learn with us today, and remember to like and subscribe for more content.